Hi, I'm AK Agumbiade, your trusted ER doc. Today, let's talk about medical gaslighting. Have you ever had any medical professionals dismiss your medical symptoms only to find out later on that it's actually a significant diagnosis? The truth is, if you're a woman, a person of color, someone who speaks English with a significant accent, or if you don't speak English at all, this is more likely to happen to you. The only thing I'll say is that if you speak English with a British accent, okay, that may not apply to you. But on a more serious note, I've seen this happen pretty often, and it's very infuriating. I've had many patients come to the emergency department seeking a second opinion on legitimate things that they had, but either their primary care or another ER that they went to did not take them seriously for whatever reason. To be more concrete, in the ER specifically, there are studies that show that often women are ignored when they come in saying they have chest pain and it's chalked up to their anxiety, and heart attacks are missed because tests are not done to confirm whether or not they're having a heart attack. And it's something that we need to work on, and I think we have tried to work on. But I often think about this because I have a friend who was diagnosed with this super rare tumor called a pheochromocytoma, which is a really terrible tumor that affects the adrenal gland, and if left without being essentially taken out, could lead to someone's death, which literally almost happened to her. But for a long time, she was told by different medical professionals that, oh, it's your anxiety, it's your anxiety. I can only imagine, particularly within this American medical system that's so disjointed, how defeating that can feel as a patient. I have some tips for you though, in terms of how to navigate that, because unfortunately, not all doctors are built the same. Certain things I think would be good for you to consider are: one, find a doctor, whether a primary care or specialist, that you are comfortable with, meaning making sure they have good bedside manner, making sure that they can explain what you have in a way and or a language that you can understand, and also just making sure that they got the right vibes and they're nice people. The truth is, medicine is an art and not a science. What I mean by that is that sometimes we don't have everything to be able to figure out what's going on with it. Either the technology or the science is not good enough to figure out what's going on or even treat what we may discover. But I think it's important for patients to be able to find providers that can advocate for them. And that starts by just finding people who they're comfortable with and people who they vibe with and people who listen to them. Another important, I think, tip to use is take notes. Take notes not just when you're speaking to a doctor, but also take notes of the symptoms you have. Take notes of the times you have the symptoms. Take notes of the situations you have them, either maybe on your notepad, on your iPhone, or even on a piece of paper or something. That will help give people information about what may be going on. If your friends ask you where you got this great advice from, tell them that you follow AK Gumbiade, the trusted ER doc, and follow me for more tips.